Public health advocates and researchers have backed up their call for a sugary drinks tax with a petition signed by nearly 10,000 people. That petition was handed to Green and Māori Party MPs in Wellington this morning, along with a policy brief showing options for how such a tax would work. This report from Michael Kropp.
On average, New Zealanders consume 6 times the recommended amount of sugar each day, and those 37 teaspoons are having an impact on our waistlines. We're the 3rd fattest in the world, and our health, causing type 2 diabetes, gout, fatty livers and tooth decay. Dr. Rob Beaglehole, a dentist, showed 11 teeth pulled from a 3-year-old who had been drinking Coca-Cola out of a baby bottle.
Every single day in New Zealand there are multiple kids, young kids, who need to have a general anaesthetic to have their teeth taken out. Last year, 6,600 kids had a general anaesthetic to take out one or multiple teeth. We also know that last year 30,000 children had one or more teeth taken out.
The policy brief, also delivered to MPs, outlines the problem and provides 3 possible tax options ranging from about 30 cents to $1 per litre. It says a tax in the middle of that range could raise about $100 million a year to spend on health and nutrition education, while cutting consumption among those worst affected, those on low incomes, Māori and Pacifica. Marama Fox, co-leader of the Māori Party, says such a tax would help drive the price of sugary drinks up.
Teeth should not be an indicator of wealth for our population, and if you look at those who are affected most by teeth decay, it is Māori, it is Pacifica and the Asian community actually. Māori, I think, consume twice as much on average for every child of sugary drinks than non-Māori.
The Green Party's view is similar. Their health spokesperson Julianne Genter says the chronic diseases associated with excessive consumption of sugary drinks and other junk foods are a problem for everyone, and therefore tax is a solution. The Opportunities Party's deputy leader Jeff Simmons says society is setting up kids in poor communities to fail.
If you are growing up in conditions of poverty, you are more likely to eat these cheaper processed foods, one because of expense, but also just because your parents are working 2 jobs and need to put something on the table, and because you're more likely to be stressed, so actually you are more attracted to sort of the sugar hit that sugary drinks and junk food generally provides.
Despite such a tax having the backing of the World Health Organization and local health groups such as the New Zealand Medical, Dental and Public Health Associations, 74 health professors, the Heart Foundation, Toi Tangata, Hapai Te Hauora, the government is yet to be convinced. Health Minister Dr. Jonathan Coleman says he's keeping an eye on the emerging evidence and practice, but he says there's no evidence a sugar tax decreases obesity rates. Instead, he points to the Childhood Obesity Plan and its wider range of interventions, and the food and beverage industry's recent commitment to develop solutions to reduce childhood obesity. For Checkpoint, call Michael Kropp.